The majority of the patients that I see are for a variety of different breast surgery reasons. I do a lot of breast augmentation as well as breast lifts or breast reduction. And then a significant part of my practice is breast reconstruction for breast cancer patients. Breast reconstruction has really evolved a lot over the last 5 and 10 years. There are various methods that we use, some of which are as simple as implant reconstruction. Others utilize skin and muscle and potentially fat from other areas of the body. And then some use a combination of the two. And in each case, what we're trying to do is choose a method of breast reconstruction that is going to best suit that patient. Each one has advantages and disadvantages. Some have longer recoveries than others, but in each case what we're trying to do is look at the individual patient from both their overall health standpoint, their age, the size of their breast, as well as what's going on in their life with regard to getting back to work or getting back to taking care of their children. Typically, a patient is diagnosed with breast cancer. Either they have felt a mass or they've had a mammogram that was abnormal that then prompted a workup and a biopsy. And then once the decision has been made that they're in fact going to have a mastectomy, then that patient is referred to us and we sort of go through the various scenarios with different types of reconstruction. A lot of the patients that we see have breast cancer obviously on one side, and so the opposite side becomes an issue with regard to what you might do to that side so that they can have better symmetry once we reconstruct the cancer side. A lot of women are uncertain about that with regard to whether or not insurance will pay for it and whether or not they are going to have to, and it turns out that the insurance companies see the opposite side being done as simply part of the reconstruction. Patients in the Austin area that are unfortunately diagnosed with breast cancer, I think that they are actually very fortunate to be here in Austin because there are a number of talented general surgeons who are able to do the mastectomy. I think that there's a great number of oncologists that are very talented as well, and there are good plastic surgeons in Austin. We're very fortunate, that the patients that are here are able to stay here. They don't have to go to, major medical centers because we have state-of-the-art surgery that we're able to do here. For a lot of people, this is a pretty devastating diagnosis. Their decision to have a mastectomy and then to have a reconstruction is a big decision for them. By providing them with a very good outcome, that they are able to not only beat the cancer itself, but they're able to get on with their lives and they are able to have psychologically a better outcome and feel better about themselves.